With elective hospital procedures being halted, hospital systems around the country are coping with a tremendous financial hit. Some are laying off employees or furloughing them. This morning I talked to CEO Alan Levine of Ballad Health System about the impact it's having on Ballad.
The president and the governors have called for the elimination of all elective procedures in hospitals. That's where most of hospital revenue comes from, and that's where most hospital margins come from. We've lost, about 40 to 50% of our projected revenue. As volumes go down, we reduce hours. And unfortunately, a lot of our team members have felt the brunt of that as we've flexed our staffing down. Many of them are using their paid time off that they'd accrued. That's obviously something that we're concerned about for their sake. The 3-month impact that we have projected based on what we know has happened with our volumes is we've projected about $150 million negative impact. We're starting to see it happen all over the country. Several major Appalachian Regional Healthcare just furloughed 500 employees Friday. We have to deal with a 40 to 50% drop in our services. And so how do you handle the labor issues that come with that? On the other hand, we have to be prepared to ramp up quickly. I mean, if we get hit with the virus or if things get better, we have a great amount of concern for our staff members who've been flexing down and have been using up their paid time off and are facing running out of paid time off. So these are all things that we're evaluating over the course of this week, and we'll be in a better position to make some determinations once we identify what are the right things to do. Yeah. One thing I can tell you is whatever decisions we make, they're going to be well informed, and they're going to be based on what we think is best for our staff. There's an announcement that CMS, the Centers for Medicare and Medicaid, made yesterday that will allow hospitals to get advanced payment for procedures that have not yet been done or admissions that have not occurred. This is not new money. It's basically an interest-free loan to hospitals, which will have to be paid back. Right now, there's a lot of discussions up in Washington about how to deploy those dollars. And so right now, it's too soon for me to tell you what the impact would be on Ballad Health or how fast we would get access to those dollars, but it would be very helpful. What they did in the area of unemployment benefit, enhancing unemployment benefits, that could very well be a major benefit to a lot of our team members and to Ballad. It's financial carnage that's happening right now to hospitals, and we're grateful that our senators and our delegations in both Virginia and Tennessee stepped up to help us and to advocate for us. Hopefully the resources will flow quickly because that'll help mitigate some of the really more difficult decisions we might have to make. We're going to do what we've got to do to take care of our nurses, our respiratory therapists, and other people who are direct caregivers because they've really been impacted by this, both professionally and emotionally, and so we need to be there to support them.
In Johnson City, Tennessee, Jeff Keeling, News Channel 11.